What is one of the things that people don't know about medical family therapy research that, from your experience as educators, that when you tell the students about it, they're kind of blown away by that? I know it's kind of a weird question.
Blown away.
Wow.
I think probably some of the politics of conducting it. You know, we've done some recent studies where...
It's a good one.
Yeah. The IRB is one entity which we're all familiar with and accustomed with, and it's a great thing because it makes sure that participants are protected.
Sure.
Well, in healthcare, there's HIPAA. And so HIPAA makes sure that patients' privacy rights are protected. Well, when you're doing research in a healthcare setting, you oftentimes have to have your research also looked over and approved by the HIPAA privacy officer, who sometimes is not a researcher and not a clinician. It could be an attorney. So that is another layer of policy and bureaucracy that researchers may not be prepared to deal with, and that could certainly be a challenge for people, and to be aware of that, and that you want to definitely cover those bases.
Right, this privacy officer, as you said, would probably be a lawyer who's got liability on his or her mind, right?
Absolutely.
And they're probably a very powerful person.
Very.
You know, because the hospital doesn't want to get into trouble in any
not.
way. And so how important is it to make a relationship, or do you have any examples of how you've been able to I almost wanted to say buy off the privacy. No.
We haven't bought off any privacy officers yet, have we?
But how do you develop a relationship of trust with that person so then they come and they go, okay, this is a solid program, or these individuals are they do have that first do no harm mandate in the back of their minds as they go about doing the research.
Well, at least at our institution, I think that there's been office personnel that we've been able to build relationships with in that privacy office, and that has really helped. I think also our IRB, because this is relatively new. It's only been within the past several years, I would say, that that we've really surfaced this. So, as we begin to do more and more of these studies, the IRBs recognize the need to be more collaborative with the privacy office, and so they're really working on that partnership too. So we have our relationship with that office, but the IRB is also needed to work with them because researchers sort of get caught in this delay that happens, and so the IRB may get their stuff approved, but you're waiting for a while for the privacy officer too. So, and the IRB recognizes some research is time sensitive, so they've stepped in a lot and helped navigate some of that and educate the privacy officers about research and what's involved, and the privacy officers likewise educating the IRB about what their job is. So those two entities have had to have conversations more, I would say, even than the researchers in the privacy office.
I would say, though, that's a benefit of the MFT. Because we are relationship experts and we see things systemically, you can kind of pull back and see how all of the parts are involved. So it's been really good to get to know people on a face-to-face basis and understand where they're coming from and them with us, because some of the IRBs have taken several months, and it's not just the ECU IRB, but if there's a hospital involved and then somewhere else where it's kind of an outside system that has to also review the IRB. I've had one recently that took almost 18 months from start to finish, and so you really have to hang in there and recognize that the work is going to be really important work.
Yeah, and with a timeline like that, I mean, I go back to how the policy can shift, how economics at the state and federal level can shift, and it could really wreak havoc with a research design, couldn't it?
It didn't in this case, thank goodness, but certainly my concern was turnover during that time frame. If any new person had to come into that, I was going to have to re-engage and make sure that they understood where the momentum was to get it to completion.
And depending on the systems, the other challenge might be more academic systems may be more used to research, and so academic clinics and medical centers, there's pluses and minuses. They may be more used to research, but then they may see anything you do as temporary. So, okay, this is just a grant, let's just do it, and then it'll be gone. Whereas community health centers, they're more embracing of the protocol, and how do we strengthen, and keep this protocol and sustain it, but we're not so fond of data and research, because we don't want you to just come in here just for the numbers. So there's different politics that, we find we've had to learn how to navigate so that we can, join with these systems and we can conduct this. But we also have an ethic, I think, between the two of us where we refuse to do any kind of research that just uses a system and then we walk out. So all the research that we do or our students do has to contribute in some way to that setting, either through sustainability or information that helps to strengthen that setting. We just don't see we don't see ourselves ever doing the kind of research we just go in and study and then pull out. So that to us is another layer of responsibility that we're trying to teach our researchers so they can advance and make a difference in those three worlds that we were talking about.
Okay, all right. Anything else you think people need to know about medical family? Obviously, it's a short interview, but and also hopefully the kind of thing that people can kind of follow up with you both and check out what East Carolina is all about and what medical family therapy and that collaborative healthcare model is all about.
I like to also encourage, look at ECU, but then also if you're a researcher, you've already got your degrees and you're just wanting to do more in this area, organizations like the Collaborative Family Healthcare Association are wonderful ways to involve yourself with other people who are also trying to advance research in this area. Society Behavioral Medicine is another one. So there are several organizations and entities that are popping up where healthcare researchers are really trying to come together and advance this so that medical family therapists find themselves often connecting with other disciplines and other associations besides the American Association for Marriage and Family Therapy.
Right, which is really what this is all. I mean, being successful as a researcher is about collaborations and crossing interdisciplinary lines. Okay, thank you very much.
Thank
Appreciate
you.
your time today.
Thank you.